All right, I will go ahead and get us started. Thank you everyone for joining us today, whether you're here with us live or you're watching the recording. We're delighted to have you join us to talk a little bit about our Master of Arts in Bioethics and Medical Humanities as we talk about exploring kind of this world during a gap year. That's really our focus today. We'll go ahead and move forward. So in terms of the things we're going to cover with our agenda, we'll talk a little bit about Case Western Reserve and the School of Medicine, kind of where we're positioned in our department. We'll do program overview. We'll talk a little bit kind of about program outcomes, where students go on, how the program gets them there. I think that's the big takeaway of students really utilizing this gap year in order to move on to the next phase of their career path, and that's really important. We'll talk briefly about application process and deadlines, student assistantships and financial aid, and then leave time for Q&A at the end. If you have questions, please feel free to submit to the Q&A feature here on Zoom. We'll try to keep an eye on them, so we may answer them while we're talking, but we may also save them to the end of the presentation. And I will turn it over to my colleague, Dr. Mark Aulisio, is here with me. Dr. Aulisio, I'll let you introduce yourself a little bit more.
So I'm Mark Aulisio. I'm the chair of the Department of Bioethics here at Case Western Reserve University, direct the Center for Biomedical Ethics at one of our affiliate hospitals, Metro Health. And as you can see, that picture's a little dated. I have much more gray. Although I wouldn't say I've lost all that much more hair. But I'm really glad that you've joined us, and we'll do our best, especially with a small group live, to answer your questions and be really engaged with you as we go through the material. So don't be shy about putting a question in the chat, because we'll do our best to answer it. And if we can't answer it now, we'll get back to you quickly with an answer. Okay. All right. So my background is analytic philosophy. We'll get to Leah in just a second. I've done clinical bioethics really all my career. And so, that's my focus, whether it's ethics consultation committees in a clinical setting or topical issues like, rights of conscience or conscientious objection, resource allocation in healthcare, end-of-life decision-making, some beginning of life issues, informed consent, confidentiality, privacy. These kinds of bread and butter clinical ethics issues have really formed the focus of my interests academically and in the clinical setting for over 20 years now. Leah?
So I am Dr. Leah Jeunnette. I am the Assistant Director of Education and am now the Director of our Master's Program. I also am an alum of the Master's Program. So I graduated a number of years ago, and it's very full circle to be a part of the program on the other side and to work with our incoming students and to teach in the program. I'm also a clinical ethicist at University Hospitals Cleveland Medical Center. So areas of interest for me besides clinical ethics include adolescent health and just ethics education in general. So I've been in the department now, oh goodness, it'll be 7 years this fall, which it seems like yesterday I was just starting this job. So time goes quickly, but I'm delighted to be here and to talk more about how this program can really help during a gap year for students.
I've been at Case since 2000, so you can imagine, and it's a platitude and it's cliched, but it is true. Time goes quickly and seems faster as we go forward.
True.
So a little bit about Case Western itself. We're considered the top. You put stock in these rankings more or less, so whatever. And different rankings say different things, but what's really clear, we are an excellent medical school, and we have excellent basic science departments. A few years back, we were the 11th most cited set of basic science departments and biomedical research groups in the world. For medical school itself, just med school rankings, it depends how you look, 24th in the US, top in Ohio. What these kinds of rankings don't get into is some of the quality of the education and honestly, the quality of the students. One of the things I like to brag about our medical students is that for 3 consecutive years before COVID, we had 96, 98, and 97th percentile as our average MCAT percentile for our med students. And we have plenty of med students who do an MD, MA with us, and they're really good. And our graduate students are excellent as well, as our undergrads. So, we're a national research university and can hold our own in various areas with pretty much anyone. So we're proud of that and not going to be shy about it. We're trying to do better, not being shy about it. Why study bioethics and medical humanities? I mean, good question, right? You could say, well, what is bioethics and medical humanities? And, in many ways, what bioethics and medical humanities is about is using different disciplinary lenses to understand an aspect of a complex problem that requires multiple lenses for us to really appreciate and understand it, and then identify how to address whatever that problem is and move forward. And when you think about healthcare, whether it's, biomedicine and the research endeavor and developing things that will feed into healthcare, or the actual delivery and practice of healthcare, there's no one who is unaffected by that. It's just a fact of our existence in today's society. And, often the things we focus on in bioethics and medical humanities are partly a function of advances in science and technology. And these advances can create ethical issues we didn't face before, like you have a ventilator, should we turn it off or not, right? The concept of brain death was driven partly by the emergence of a ventilator, and the need to procure organs for transplant was impacted the concept of brain death. So, and you see this over and over. And one of the things you should ask when you're talking about research or you're talking about clinical practice, which core values should inform policy and practice? How should different kinds of technology be developed and accessed, and by whom? And what do justice and respect for persons mean for research and clinical practice? These kinds of questions are really important, and they're central to bioethics and medical humanities. So if you think about a career path, how might bioethics and medical humanities as a gap year kind of feed into it? Well, first of all, bioethics and medical humanities historically, from the start, is arguably interprofessional and multidisciplinary. So there are going to be lots of spokes on the wheel, or lots of areas that are connected in the web. So you can think about a one-year program like ours feeding into one of the health professions, whether it's social work, nursing, medicine, a number of what we used to call the allied health areas. They're important connections for the health professions, and you could have a niche area that goes with your professional area if you focus on bioethics and medical humanities at the graduate level. You think about health law, health administration. We have dual degree programs with the law school. We have dual degree with social work. We have dual degree with medicine. But you could do this year now, and then later throw yourself into the rigors of professional school. Research ethics and regulation, IRBs, the whole regulatory and ethical apparatus that looks at the practice of research. Another area that you could end up in as a career path. Of course, academia, whether it's the arts or humanities, or specifically bioethics or medical humanities. On the clinical side, like Leah has ended up and I have ended up in different, at least for part of our jobs. And then the academic side, which is, sometimes you can combine the two, sometimes they don't go well together, but there's a place, and there seem to be increasing opportunities in bioethics and medical humanities in both of those areas. And of course, you know, and a lot of our students, in fact, use the year this way. Figure out what you want to do, what your next step is, and it's okay to change your mind. We've had folks come into our program, we're going to go to med school, I'm going to go to med school, and they end up, I don't think I want that. I think I want to be a PA, you know, physician's assistant, or I'm interested in nursing school. I'm interested in health policy, right? I want to be a clinical ethicist. There's a lot of different possibilities here. And it's not a bad thing to take a year, think about your trajectory, and then move forward after it. And that's worked really well for a lot of our students. Okay, RMA, we're celebrating 28 years this fall. Oh my gosh, that's incredible. We're proud of that. If you do the program full time, you can complete it in 2, you know, regular semesters, fall and spring. You'll do 30 credit hours, but you'll have, you know, a handful of requirements, but also a good amount of opportunity to select from our electives, either offered by our department itself or across the university. We do have what we've thankfully somewhat post-COVID now revitalized this year and put back on the schedule. I just actually got back about a week and a half ago from a month trip to Spain and Italy. The first 2 weeks was a course in Granada. It was a study abroad course, Spanish and American perspectives, US perspectives on different issues in bioethics. It was really fun. And Granada, what a city, and we have great colleagues there. That's just an example. Anyway, personalized advising for each student and our dual degree options. I've mentioned a couple of them: MD, MA, MSW, MA, JD, MA. We have an MPH MA. What am I leaving out? Oh, genetic counseling MA. I think I got most of them, but you know, we have a good array, and we have more or less takers each year. It's a challenging thing. It's okay. We know it loads you up, but for some students, that's a good option. We do have, Leah, do you want to describe our concentrations a little bit? Dr. Jeunnette?
Sure, sure. So what's great about the way the program is designed is the curriculum really allows and highlights this customization. And so for students, we have, by default, everyone could do the traditional program, which sets up for the most amount of electives, sets up for the most amount of variety, or allows students to really focus in on where they are going in their career path. There's also then the option of 3 concentrations: medicine, society, and culture, policy, which is our brand new concentration we're launching this fall, and research ethics. And within each of these concentrations, we have specific courses that are set aside for these courses. There's both a core course, a mini elective, and in the case of research ethics, there's a really great practicum that students are embedded with a research team, whether it's an IRB or some type of research project, and you really get hands-on experience. For all the options students have, and if you want to go to the next slide, this will really demonstrate it. There are some courses like Foundations in Bioethics 1 and 2, the first semester of clinical rotations, and the capstone. All students will participate in, regardless of doing the traditional program or any of the concentrations. But then in the specific concentrations, the number of electives can vary, which core courses you can take can vary. And in some cases, for students who are very highly motivated, we can even talk about combining 2 concentrations. So in some cases, we have students who really want to do research ethics, but they're actually interested in more of a global perspective on research ethics. And so it makes sense for them to combine research ethics and the medicine, society, and culture concentration. And so there can be a way to do that. And so while this slide itself may be a little overwhelming,
You don't have to digest it now.
Yeah, it does ultimately show that there are some things that everyone's going to take for core courses, and other things there are options and requirements. But for every student, and this goes back to the personalized advising, you will sit down with your advisor and talk about what your goals are, what you want to get out of the program, identify as a concentration right for you, what electives make the most sense for you, and they can really hone in on what path makes sense for you, both during this program and also to lead you out of the program once you're graduating and moving on to the next phase of your career.
Yeah, thank you. The nitty gritty, you don't need to worry about so much. You just have to have a sense that, yes, this is a very malleable, tailorable program. We are really fortunate in that we have 4 excellent teaching hospitals that are affiliates of the School of Medicine, and happily, all of them collaborate with our department. So we have the Cleveland Clinic, which, everybody knows about, Metro Health, which is the county hospital, the public hospital of Cuyahoga County, outstanding a hospital with a very active life flight and ED and level 1 trauma center, a burn unit that our students have access to learn about the challenges of burn care and the ethical issues there. The Lewis B. Stokes Department of Veterans Affairs, one of the largest in the country, right, nearby here, and university hospitals as well. Also, right on the same campus here, at least as far as the main medical center goes. We have rotations ideally for our students. We like to do 1 public hospital, 1 private hospital, so Metro or the VA, and the clinic or UH. It doesn't always work out that way, depending on the capacity of the institutions and student needs, but that's kind of our ideal, because you see the differences in culture between these institutions, and they're especially pronounced if you do public-private. All excellent in their own way, but just really different missions, different patient population, different challenges, and really interesting experience. You will get around in a variety of areas at whatever hospital you're at. You'll engage a bit with an ethics committee. You'll get an ethics committee observation experience, an IRB experience. Other possibilities are there as well: animal research, rehab, transplant. I mean, there's a lot. And on occasion, you'll get some nice one-on-one engagement with health professionals. In general, if it's your first experience of a clinical setting, hospitals can feel a little bit, daunting. If you're familiar with them and kind of comfortable in hospital settings, then that's not as big an issue. But we do have some really welcoming health professionals who are happy to have our students rotating in those settings. And sometimes they'll put you on the spot and say, okay, ethics student, what do you think? But most often they just want to engage with you and learn about your understanding and your interest in your career trajectory as well. So we're lucky here, and you'll meet in preceptor groups weekly with other students who are rotating at that hospital. You'll talk about the things you see. You'll do a couple case analyses. Dr. Jeunnette is over the clinical rotations and does a great job with it. But this is a feature of our program that we're really proud of, because it's pretty unique. And to have an array of hospitals like this that we can place our students in, well, we're very happy about that.
I think the other thing that's really unique about the way that the rotations often can affect students is students go into these rotations and sometimes they think, I want to be a physician, I want to be a nurse, I want to be something specific. And then during these rotations, they come across positions and jobs they didn't even know existed, and they realize that that's actually the right fit for them. And that part I love seeing as like a secondary byproduct of this course. It's not intended to be a goal, but it often comes out with a handful of students, especially those who are searching for discernment every year.
Totally agree, completely. Okay, here's our short-term study abroad. So I started to tell you about the Granada course a little bit. I'm going to let Dr. Jeunnette take this over, but this is another thing we're proud of. We highlight the jewels, of course. So that's what
Yeah, These courses are wonderful. They count as an elective for our students. They are anywhere from 1 to 2 weeks. Students travel either during winter break, spring break, or May. So they're a really great way to dive into a specific bioethics and medical humanities topic, a specific culture, and compare it to how the US is set up, or how the US or our culture or system is set up by comparison. But it also allows students the flexibility with their credits, because they're considered intensive. So they're done over a week or 2 weeks, which is great. It's amazing to me. Sometimes students choose a course based on location. Sometimes they choose a course based on topic. Sometimes they choose a course because someone else recommended it to them, or they like the instructor that's teaching it. What I tell students is there isn't a bad choice. These are excellent courses. Students really get to see the locations they're going to. They get to meet people. They really get to understand the heart of the issues that they're talking about. And they're just a great addition to our program for our students.
And generally on site, in country, they're taught by faculty that we have developed relationships with over the years, and who actually tell us really nice things about our students. So we appreciate that opportunity that collaborating with others affords our students. And talk about the research.
Yeah, I'm happy to talk about this. So there's ways that students can also strengthen kind of their skill set, especially when the areas of research, we often get asked this by either prospective students or our current students, how can I get involved in research? And we have a number of ways students can get involved, whether it's working directly with our faculty and staff on a research project specifically. And our faculty and staff are very research active, both not just only at the local and national level, but also internationally. But we have events, we have seminars, we have grand rounds that students can participate in, learn from, to see all the research activities that are going on. We also have events that teach students research skills so that you can strengthen and learn more about how to do research in the world of bioethics and medical humanities, because not everyone comes with that skill set. You had to learn it at some point, and this is a great way to do that as well.
Next phase. So we do, as Dr. Jeunnette mentioned, have personalized advising for each student. We do try to help you find your way forward through, really good collaborations among the faculty, but also we're really well networked in a variety of areas. We are an interdisciplinary and multidisciplinary faculty. We have folks with backgrounds in philosophy, medicine, law, anthropology, history. I'm leaving a whole bunch out. Bioethics, literature. So it's information sciences, just to name some, and I didn't get them all. But that allows us to have good sense as a faculty of, okay, we have a lay of the land, and we can help you kind of find your way. And Dr. Jeunnette knows this, I'm really proud of what our grads have gone on to do and how they do find their way. And it's fun. And not everything about getting old is bad. And if you're a teacher, if you're an educator, one of the really nice things is to see what your students go on to do. And our students do make us proud. So we have what you would expect and more when it comes to kind of helping you along your path. The nitty gritty, the stuff that you got to do if you're going to join us. Go ahead, Dr. Jeunnette.
So for a completed application package, we ask for transcripts from all undergrad and grad programs. At the application phase, they can be unofficial transcripts. That'll save applicants both money and time. We ask for a personal essay. What we're looking for is your interest in bioethics and medical humanities, and how does it fit into your career path? We ask for a CV or a resume, and then 2 letters of recommendation. And we ask that one of those is from some type of faculty, professor, or previous instructor. And then once we have that completed application, it's reviewed by a member of our admissions committee. And then you'll also have an interview with someone from our admissions committee. The thing that takes the longest is usually the letters of recommendation. But once we have that completed application, it takes about 2 to 3 weeks from start to finish to give a decision or to render a decision for an applicant. So it's a pretty quick process because we do rolling admissions, which is great for our students and for applicants so that you can quickly know the decision that's going to be made. So in terms of financial aid, we have student assistantship. This is a really unique opportunity for students to get involved in teaching, research, or administrative opportunities within the department. In exchange for the work that you're doing, you receive a partial tuition waiver. So if you're interested in learning more about this, happy to have a separate conversation. There's a lot of details to discuss with it. Now we don't have enough time to cover all of it. But then there's also traditional financial aid available. The financial aid office at Case Western Reserve is wonderful. There's a lot of opportunities that they can assist you with as well.
Here's a sense of our timeline.
Yeah, so our final deadline is August 1st. So we have a little bit over a month left in the application cycle if you're planning on starting with us this fall. So if you are looking to submit and join us in August, I encourage you to get your application in as soon as possible. We can review it, get you our decision, and then get the ball rolling so you can move. If you're not located in Cleveland, you can move to Cleveland because we are an in-person program. And I know that process can take some time. And classes start the end of August.
So time for question and answer.
Yeah, I'm looking to see if anyone submitted questions. I had we had some questions that were submitted ahead of time. There was a question involving if they're doing this program during a gap year and they're looking at pursuing medical school, how much time is there to think about studying for their MCAT, applying for medical school while they're still doing a master's program full time? Is that a realistic thing to do versus someone who's doing a gap year and is just focusing on the application process for med school? I think that's a great kind of question to think about.
Yeah, it is. It can be challenging, of course, but we have had many students who have done just that. And in fact, gotten into schools that they didn't get into. We can't promise that. Nobody can do that. But what we can say is that the track record has been good with students getting a look who weren't getting much of a look before. I think it's really doable. And the reason is you're keeping your brain exercised, you're staying, but it's something that's highly relevant. And another thing that we get from a lot of our students, if they go into a clinical area, they get lots of questions about, okay, so, they're often in their interviews, what folks are interested in is that they did the bioethics program, the Bioethics and Medical Humanities. So I think that it's really doable. The problem with that, if you do just take the year and focus, it's fine, it's good. You can prove your MCAT, you got to stay with it, but you got to make sure that's what you actually do, number one. And the other thing is that if you do that, how much did you improve your application, right? And then I guess I'd throw a third thing in, which is, are you sure? Are you settled? Because the program is really good for that last bullet on the list of career trajectory things we talked about, which is helping you kind of figure it out. I mean, it's not our main purpose, but it ends up being a part of what we do for a lot of our students. So my attempt at an answer to that.
I think that makes a lot of sense with your answer. And if a student's taking that gap year to focus on studying and application, they're likely also working or getting a job, which is still going to take up some of their time.
Yeah.
And so, to a certain extent, going to school could in some cases replace that employment slot or time in your day. So I don't think it creates an additional burden by any means to do this. And that could be true also if you're looking to go to law school and studying for the LSAT or any, direction you're looking at and prepping for whatever kind of application you're going to submit.
And you might change your mind.
It's true. It's true. I was one of those. I came into this program how many years ago and was like, I'm going to med school, and then clearly didn't go to med school. So there's a great question that came in. How do dual programs work? For example, the MD-MA program, do you matriculate into the MD program, or do you need to apply after completion of the MA program?
Okay, great question. The dual degrees, you have to apply separately to both programs. You have to be accepted separately to both programs. And then once you're accepted into both programs, then the dual degree is something that your advisors will look at with you, right? Now, you indicate your interest. That's important, but it doesn't happen automatically. So it's we can't guarantee admission to the other program. The other program has complete control over that. We can only make our judgment about admission to our program. Okay.
Yes, and for each of the dual degree programs, there's a little bit of a different timeline as well. And so if anyone's interested in learning about the specific timeline of the different dual degrees, feel free to reach out, and happy to have a conversation about the specifics of each of the dual degree programs. Because for instance, the MD-MA, it's highly recommended that you start during your first year of med school, versus a program like the JD-MA, you start that actually during your second year of law school. So the timeline's a little different for each of the dual degree, but right, you still have to apply to each program independently.
Yes, that's right. A question about how large is the program? It varies. We've had as many as 66 students, and well, it was a long time ago, but we've had, in the 20s, right? But generally we're around 40, 45, 50, somewhere in that ballpark. We did not create this program as a standalone. We created it, well, you saw from the overview, as a companion to another professional in a professional area, or a stepping stone to a ladder, you might call it, to a doctorate, right? We have had students use it as a standalone, and they've done surprisingly well, given that we didn't design it for that. But the idea, what we think, is that a lot of people can benefit from this. And so, we have cast a pretty wide net, and we try to err on the side of acceptance. You will not be disadvantaged for applying late, especially because we haven't made decisions about, partial tuition waivers or much of anything, to be honest, because even enrolling for classes, other than case undergrads who are matriculating through the IGS program, nobody has enrolled in classes yet. So almost nobody. But of course, do it soon, because there's not a whole lot of time left if this is something you're serious about. Okay.
So I think for the sake of time, that was our last question. If anyone has other questions they want to ask, or they want to follow up about their specific circumstance, or even to find out if they're the right fit for the program before even doing their application, please feel free to email us, bioethics@case.edu. I'm happy to set up a one-on-one appointment with you to talk about your specific needs, your specific circumstances, and answer your questions, and also direct you to any faculty that you want to connect with as well.
Yeah, we try to be really good about that because we know it's important for you and it's also important for us.
So thank you to everyone who's joined us today. Dr. Aulisio, thank you so much for your time. I appreciate it so much.
Thanks.
All right. Have a good rest of the day, everyone.
Yeah,
Bye-bye.
we're approachable. Shoot us an email if you need to. Okay. All right.